Thank you all for joining this really important discussion about mental health and the role libraries can play. We've put together a wonderful panel today. What I can tell you is everyone here is extremely passionate about this topic and passionate about the challenges and the crises that we're all facing and that our students and faculty are facing and what we can do to help. What we're finding is that libraries are critical allies in this mental health crisis, and the role libraries can play is really important in supporting colleagues trying to support the students and faculty as well. So allow me to introduce myself. My name is Audrey Marcus from Clarivate, the general manager of the books division, and I'm going to let each of my esteemed panelists introduce themselves.
Hi, everyone. My name is Neil Grimes. I'm the Education and Curriculum Materials Librarian at William Paterson University.
And I'm Lisa O'Donnell. I am an assistant professor at Wayne State University in the School of Social Work. I'm also the director of the master's program, and I am also a practicing clinician.
My name is Linda Salvesen. I am a systems librarian at William Paterson University in New Jersey. I also put my bachelor's degree in psychology to actual use in doing some research on academic librarians and burnout, as well as writing a book chapter on how libraries can support the mental health and well-being of our communities.
All right, thank you. So we've got some questions for the panel, and of course we've got some pre-submitted questions. And this is a lively discussion. There are microphones at each end, and we will absolutely make sure there's plenty of time for questions. But I'm going to open it up to the panel. How has the COVID-19 pandemic specifically impacted the mental health of students and faculty, and what unique challenges has it posed for libraries in addressing these issues? So whoever wants to start.
I'll jump in here. Student mental health. Oh, thank you. Everybody can hear me, right? Okay. So student mental health is tied very closely to academic performance. So just like in a nutshell, right? So academic librarians are supposed to support the student as well as the faculty at our institutions. And so it only makes sense that we are supporting the whole student when it comes to mental health issues.
I'll chime in a little bit too here. So what I wanted to share is a little bit of background information on this topic. So during COVID, 3/4 of all college and university presidents listed students' mental health as the most pressing issue. So this is an issue in higher ed that every librarian and every institution, should be concerned with. Mental health has direct ties to student retention, graduation rates, and most importantly to student well-being and wellness. The top 3 conditions that we found that students have been treated for in terms of their mental health throughout COVID were stress, anxiety, and depressions. These kind of reached unprecedented levels as a result of the pandemic, and they're still, I would say, fairly high. Another point I wanted to bring up is, by the year of 25 years old, 75% of those that do have a mental health disorder will have had their first onset. So that's kind of important to note. And then another kind of background fact, 1/4 of college students today have taken psychiatric medication, almost 1/3 have sought counseling, and more than 1/3 report having a mental health disorder. So these are all good reasons why we should be concerned with this kind of moving forward.
Can I jump in?
Yeah, go ahead.
I want to highlight a point you made that I think is extremely important, is that the onset of mental health conditions, that starting college is a very common trigger for the onset of conditions. So not only are students experiencing them, but they're not necessarily aware that they have that condition. And so that's why it's so important that all faculty and staff that are interacting with students have knowledge about this, right? And know how to respond and talk about it with students. Just on that.
Yeah. And these are some of the challenges that we found as researchers specific to academic librarianship. So, not all academic librarians have received mental health first aid training during their master studies or while in the profession. Librarians might not have received training on how to use bibliotherapy, which is an approach that has been used since the ancient world as a method for alleviating mental health issues. And another issue and challenge that a lot of us face in academic libraries as well as public libraries is there aren't too many designated wellness spaces or lists of resources to share with the communities we serve. And this is something that I think academic libraries, my own institution included, are trying to address, especially post-COVID. We have received funding from our state, government funding, grant funding to implement a wellness resource room and space. And we're actively kind of working to address vis-a-vis our strategic plan and key performance indicators, how to best support students with mental health issues moving forward.
Can I add one more thing? I also want to add that there are particular students, it's important to understand, that are especially vulnerable to having mental health challenges, and we saw this in the pandemic. So, for example, social work students, generally where I work, generally have higher rates of mental health conditions than the general student population. Historically marginalized students, and at Wayne, we're a minority serving institution, so it's important to know that. Lower income students as well. And so if, for example, we have Monique, a lovely librarian that we work very closely with in social work, and she's gone through mental health training knowing that the students that she's interacting with might be more likely to have these challenges.
Thanks. So, recognizing that the age range and the critical point of uncovering and support is the patrons, the faculty that this entire industry serves. What are some of the innovative ways that you've seen universities and libraries adapt to meeting that increasing demand in mental health and services and the identification and the support? What are different ways you've seen that can have a positive impact?
I guess I'll start that question. During and after the pandemic, colleges and universities, including academic librarians, have really sought funding to kind of help to redesign and create wellness spaces, provide wellness resources, and offer wellness programming, whether in person, virtual, or virtual programming. Another point I wanted to bring up is in the state of New Jersey, we announced on October 17, 2023, this year, we're making available an app called You Will, and it's a free virtual therapy and wellness tool app that will be used across 44 colleges and universities. Young people love to have stuff available through an app, and I think it will be interesting to see over the course of the next year how much this app has kind of supported our students at our institutions in New Jersey.
I'll also talk about the Student Wellness and Academic Libraries book is an ACRL publication that came out in 2020, and it details some case studies and examples of academic libraries offering wellness programs. So I remember there was an example of the peer-assisted study group from the University of British Columbia, I believe. And so having these peer-assisted study sessions was really useful for getting student engagement. And so students enjoyed working with each other. That was a very well-attended program. So there's a lot of good programs out there that have been doing really well. And this one book, it pulls together many interesting case studies on this.
I'll add that, so one thing we know through research is, well, we know that there's a lot of stigma related to mental health conditions that exist within and outside universities. And that is a huge barrier to people accessing resources, right? So that's also an important avenue, is how do we reduce stigma on campuses, across universities. And one way research demonstrates that's very effective is hearing personal accounts of people with lived experience. And so that is something our university is moving towards, and I think that's similar with others as well. For example, we have student-formed organizations, student-led organizations around specific disabilities, where they can advocate for themselves, they can share their stories. It's very empowering for them, and it gives them a sense of community and belonging. And I think that can be very destigmatizing. We are also hoping to do a speaker series of current and former students with lived experience who share what they've gone through, what's helped them, what hasn't, what resources they've accessed at the university. And so I just think that, and also discussions in classrooms. Since the pandemic, that has really shifted. We teach a lot of clinical courses in social work, and professors are doing it, students are sharing their own lived experience, and I think the more we do that, the more impact we can have.
So, Lisa, following up on that, are there any specific resources or programs that any of you have introduced or seen introduced that are better at addressing mental health needs, and how have they been received by students and faculty? Or any of the panelists?
Well, I think I'm debating how to answer that, but one thing that I was going to share, and that is a good reminder, for example, after the pandemic, we realized that there was a huge need, right, for the mental health challenges of our students, and so the university created a crisis team where faculty and staff could submit, they call them care reports. So if they have a student they're concerned about, they can submit a report if they don't feel comfortable directly addressing it. And what we learned is the team wasn't big enough. They got so many reports that they did not expect, so many more, and they were really having trouble responding to them quickly enough and had to expand the team. So it really highlighted that we do need more, but that was a huge help for us.
At my last library, we started meditation sessions, so thinking of student wellness. That was a really well-attended program that got students from all areas, all religions, to come together and use mindfulness to improve their own well-being. And then also when it comes to working with the faculty and with library faculty, I'm on the professional development committee at my library, and one of the programs we did was chair yoga, right? And so, like bringing in activities like this to assist with the well-being of your coworkers can make all the difference.
I think some ways that you're probably looking for are ways that don't cost a lot of money. So let me kind of start there. Some things you could do once you return to work and share with your colleagues. Something I've noted that has been done in academic libraries and across universities, during COVID and post-COVID, are creating an affirmation wall in a centrally located location, whether it's the academic library, the student center, the cafeteria, and coming up with some affirmation phrases that students can kind of, just engage in the simple activity of, taking a saying like "I support you" or "Let's support one another," and putting it in, one of these spaces on the wall. Another thing I'll mention that's really low cost is coming up with, starting to curate new types of resources in academic libraries that haven't been curated before, such as Legos and puzzles and sticker by numbers and crossword books and Sudoku, things like that, I think can really help to break up a student's rigorous day of studying and working on projects and assignments, and kind of give them, just a nice needed brain break. Another thing I will mention that I've kind of noted being done is signage. Posting QR codes throughout your academic library or other centrally located buildings on campus that point students to counseling resources, community resources, things that they should be more aware of or cognizant of. Another thing that we're kind of moving towards at my own institution is creating a LibGuide of specific resources for our students. Our students to access in terms of community partners. Um, and another thing I did want to mention is a lot of universities have other people that on campus that should be invited to be a part of that wellness conversation. Our dietitian, for example, could present virtual or in-person programming to students about, proper nutrition, meeting, that part of your wellness. Community counselors could kind of present on, some easy ways or tips and tricks to, best prepare for finals or things like that. So, tap into those resources that are available at your institution. Invite them to be a part of the conversation, your library's programming. And I think, these are easy ways that all of us should be thinking about or moving towards in that post-COVID pandemic era.
Can I add?
Yeah.
I think it's important to recognize too that a lot of students now are learning online and not even coming to campus. So I think it's important to think about how do we reach them through social media channels that we have. Like, we have Facebook, Instagram, where we post, talks or, resources and regularly. Because don't assume in the beginning when during orientation when you're providing all of the resources, I don't know about you, but when I am given a lot, I tend to forget about most of them. I might remember one or two, but keeping that proactive communication going. Another thing that we found to be very helpful in our particular school, and I think across the university, peer mentors, because a lot of times students aren't comfortable going to a faculty or a staff. And so we have designated students who are peer mentors who they can go to, and they're not trained clinicians, and they're not supposed to be doing therapy. They're not supposed to be providing the direct support, but they are a great liaison to those resources. Did you want to add?
One more thing, just to jump onto the virtual thing. So in the ACRL publication on student wellness in academic libraries, I remember, I forget which library this was, but there was a library that instituted a virtual learning commons. So the learning commons became a really big thing, I think, 10, 15 years ago. And so when a university found a way to do a virtual one, that was really innovative. So I'm hoping that as we go into this hybrid world where sometimes we're in person, sometimes we're still virtual, that we're exploring other opportunities like this.
Okay. So I want to expand upon something. Neil, you started mentioning other staff that you could work with in the higher education setting. So I'm curious, within research literature or just your own professional experiences, how has mental health and well-being been addressed among staff in higher education settings beyond the library? And then expanding upon that, how can the library collaborate with the staff towards a common goal?
So I'll give a quick example that I think maybe we've thought about, maybe we haven't. But when I was a kid, I really enjoyed engaging in arts activities. And I think as I got older, I kind of shied away from that. So at my campus, one of our staff members actually offered a de-stress arts activities opportunity, I guess you could say, for faculty and staff. It was creating a de-stress Valentine's Day wreath and providing them with the art supplies and allowing them to engage in this activity from their offices during the workday. That was really kind of a fun activity to engage in virtually that really cost the library next to nothing to do. We have a lot of art faculty too at our institution, and this is something that I would like to kind of expand upon, de-stressing through the arts, maybe programming moving forward for students. And I think it especially meets those online students and those students that find they don't have as much time to spend on campuses as a lot of the other students maybe do. Another thing I will kind of mention that I think is important is also looking into other options for these types of activities. So partnering with community organizations, thinking beyond just your institution in order to bring about some better programming.
I'm just going to circle back to something Neil mentioned earlier, that just leveraging the relationships and who's at your university is really key. Social work has collaborated with libraries at Wayne State to provide training to the librarians, the mental health first aid training. So they know how to talk to students and patrons, and they know, they're knowledgeable and know how to connect them to the right resources. I want to throw in one thing that I think is relevant to this question, but I do think it's important to state, is that when somebody is in a position where they might be helping access resources for somebody who needs them, such as a librarian, it's important to understand that there are, depending on the mental health condition, it's not a matter of like, here, some therapy, go get this, or these are some clinics in the area, but understanding that there are evidence-based treatments for particular conditions. And you don't have to be aware of that, but understanding that you can access that information to help students do that too, that you could be a really influential person to connect them. So if they're coming to you and you're learning that they have OCD, right, obsessive compulsive disorder, there are amazing resources specific to that condition and very effective treatments. It's not just mental health as a blanket. So understanding the nuances as well. It's a tall order, but.
And I know we referenced the academic or university presidents stating that student mental health was the #1 thing that they were most concerned about. But also faculty mental health was I think that was second on the list for a couple of years in a row, right? So the faculty are also struggling. And in the beginning of the pandemic, right, some faculty members were able to quickly transition easily to remote teaching, but other faculty members really struggled. And so we have to keep them in mind as well. And so just as academic librarians, we support faculty, we try to work with them, keep the communication open. And I think that would provide the best opportunities for you to make sure that you are supporting the needs of the faculty as well as the students.
Thank you. So, Neil, I'm going to put you on the spot for a second, because as we were waiting for folks to get here, you and I were having an interesting conversation around your background is not that of a mental health professional. You're not a licensed social worker. You're not a clinical psychologist. You are, in fact, a librarian in information sciences degree. Curious, how did you gain the level of knowledge you have about this topic?
Thank you, Audrey. That's a great question. Like all good librarians, in one word, read. I read as much as I could that was published on this topic. I looked at how the New York Public Libraries have addressed, mental health in their communities, what kind of strategies they were doing. I read a book called Whole Person Librarianship, published by Sarah Zetterval and Mary Nenow, that talks about the crossover between the social work profession and the library profession, and how librarians need to be more cognizant and aware of treating and working with all members of a community. Another book that I read that was especially helpful and kind of informative that I will recommend is Rebecca Tolley's book, published in 2020, on a trauma-informed approach to providing library services. Another thing I will kind of mention is I received my MLS way back in 2006, and I did not have one class that talked about mental health in libraries and how you will be working with patrons that, whether in a public library setting, academic or school, that are dealing with mental health problems and issues. So I tried to write a chapter, and I worked on this chapter. It's published with Linda and another academic librarian, where we could highlight everything that we learned as a result of reading all these resources and kind of better informing the library profession in a post-COVID world as to what directions they should start, become trained on, professionally, to better meet the needs of the whole person.
Did you
Linda, is there anything you want to add? Again, you equally are not a clinical psychologist, so
I went to school for my.
You did.
Oh yeah, you have the
Yeah.
official. I mean, I kind of went to school, but that bachelor's degree, and I worked in research right out of college. But yeah, same thing of just reading, right? And so we should be feel empowered ourselves to find out as much as we can about supporting ourselves and others, and mental health and wellness areas, and then also just getting ideas from what other people are doing is what is inspiring to me. And I hope that all of you can go on to spread this word, right? And how important this is, and how we can all play a part in supporting the well-being of others.
So with that, I want to ask each of you, without repeating what another one says, what is the one action that everyone in this room could take back to their libraries to implement to have the most impact? What would each of you recommend? One action, or two if you can't choose.
I mentioned earlier, I hope I'm not stealing.
Go
Can't
ahead.
repeat each other.
I'm going first because I need to say mine because you guys probably know more about this. But we talked about, I mentioned earlier the mental health first aid, which is a training that provided by, could be nursing, social work, even our Michigan Library Association provides it. But offering that to librarians, looking into it, seeing if that's something that can be offered when, where you are. So, who wants to go next?
Linda?
Sure, I'll take it. All right, so just to go a different direction, I mean, I'll talk about bibliotherapy, right? So bibliotherapy, something that has been practiced for thousands of years, right? And so you can read about the history of it and how it's been implemented, right? And how we can take that into the modern world. And so even in a strict definition of it, you can offer fun readings, fun reading, leisure reading. We call it the leisure lounge in our library. And it's just a place to get students in the door and just to feel comfortable and at home, right? Because they talk about the library as being the third place, the place that you can go between home and work and school, where you don't feel like you're being sold anything. You don't feel like you're being, forced to do anything. You don't feel like you have to like prove that you should be there, right? You're able to go and just spend some time and just relax and maybe, talk to your peers, or even just just relax by yourself, right? And so just creating a good space for that would be, I think, the most important thing you can do.
I think bringing this up as a conversation at your next librarian department faculty meeting is an important first step. I also think that this should be added as part of academic libraries' strategic plans in a post-COVID era moving forward with this specific area, how we're supporting the whole student and wellness in terms of what the library is doing in that area should be a key performance indicator, because that is directly linked to student retention, academic achievement, graduation rate, student success, all those points. And as we delve into this world of more immersive technologies and AI, something called techno stress is starting to happen. And a lot of young people are overwhelmed by the number of apps out there, myself included. Sometimes I just want to go back to the basics, like give me a textbook and let me take notes from what I need to read, instead of, oh, you should read this and that, and being pulled in all different directions. So I think those are important. And I will also say, kind of looking at partnerships. So whether they're partnerships with other departments at your institution, if you have like a social work program or things like that, I think that's a good place to look at starting to partner with those folks, inviting social workers to, provide some professional development training for librarians, for example, and looking to other professionals on campus. and inviting them to be a part of library programming, library sponsored programming, like dietitians or maybe the athletic trainer or others. I think that's kind of really important, moving forward. So it all starts with the conversation. I'm kind of just going to leave it at that. And then once you have ideas, you have to actively ask for funding or seek out funding to fund all these wonderful ideas and initiatives and programming moving forward. But, that's my advice.
Social workers love to collaborate.
So I have a follow-up question here. Recognizing, and I think Lisa, you mentioned much earlier that not every mental illness is the same, right? Equally, not every student and faculty is the same. What considerations should folks have, or advice do you have for ensuring that we are being culturally sensitive and inclusive when supporting and also addressing?
Let's see. Well, trying to think about this. So I think that cultural kind of competency is really important, right? When and especially if you're working, at a place where it's a minority serving it, you have, a higher population of historically marginalized. So being aware that needs need to be met in a variety of ways, and it varies across populations, right? So that's, and also I think cultural competency doesn't mean that you have to know all of that. It's being able to ask those questions, to understand the individual that you are working, with, or that you're interacting with, just having a very open, honest conversation to get an understanding of what their needs are and then how you can approach that. I do wanted to add that this is, I think it's also important to remember that mental health does not exist in a silo, and that sometimes when people are having mental health challenges, it might be that other needs are not being met. And so making sure that you're aware of the resources that are available nearby. So for example, at Wayne State, we have emergency fund for students who need to pay a bill. We have a food pantry for students, who need food for their families, for themselves. We have lots of resources in different areas like sexual well-being. So there's just so many things that it doesn't necessarily mean they need directly mental health resources, but they might be having a reaction to some other needs that aren't being met.
Anyone else? So we have, unless either of you want to add, we have 2 submitted questions through the app that I'm going to take, and then we can open it up. The first one, for any of the panelists, what do you think about student agency in education as a factor of their mental health and the academic library's potential to offer interdisciplinary, student-driven, individual, and group learning?
This is a fabulous question. I actually ran into the person who posed this question yesterday. So I'm very glad I did, because that gave me more of insight into what this question is really asking. So student agency is very interesting, right? So you want to empower students to feel in control over their own education, making their own decisions, and their own choices, and giving that feeling of control will support. So the student will feel supported by themselves, right? So they'll feel confident in their choices, and so that also can move into the mental health area as well, right? So you want to empower people to seek out the resources that you can connect them to, right? So as a librarian, you can find the resources, you can connect people and let students, feel empowered to continue their well-being, plans for getting their well-being, their needs met. I think that answers the question. Do you have any?
When I interpreted the question, I teach, right? And so I was thinking about empowering students with their education and helping them, giving them control over that. And I think that has been a huge silver lining, I call it, from the pandemic is being much more flexible with what we learn, how we educate our students, and adapting what we're teaching them based on their own needs. So I always check in. I tell my students, this is a collaboration. What is it you want to get out of this class? And let me see if I can integrate you, so that you're getting what you want. If not, we always have directed studies where students can say, I really want to learn a lot about this, and there's no options on campus. Can I work with one person and learn more about it? So I think that is extremely important, like what you said, empowering students in their own education and accessing the resources that they need. Do you want to add? Or are you good?
No, I'm
Okay.
good. Thank you.
So the next question, and it may be answered in some further slides. Can you provide the title of the book with examples of library wellness programs, please? Is it in the slides?
I think it should. I think it's in the slides.
It's on the handout, but go ahead, Linda.
Oh, it is on the hand. Oh, is it on the handout?
Yeah.
Oh yes, there is a handout. There's a virtual handout.
Yeah, we're going to attach the handout to the app.
But that is student wellness in academic libraries. The subtitle is Case Studies and Activities to Promoting Health and Success. Was that the one? Yeah, that's the one, right?
That's published by ACRL. And on the handout, it lists the 4 readings that we will recommend everyone read post-conference. And these books are really important, including our book chapter, to kind of frame out what needs to be done moving forward so that librarians as a whole are better able to treat the wellness needs of all of their communities that they serve, whether it's in a public library setting, academic, or school library setting. It's creating that safe and inclusive space and welcoming space where students feel at home almost. It's like they're home away from home. When I was a commuter student, the number one place that I attribute to my own academic success was the library, because when I wasn't in class, that's where I went to get my work done, to study, to meet up with my friends. And the second place was getting a bite to eat. So your 2 most visited places on a university or college campus, even for commuter students, are going to be places where students eat and places, quiet, safe places where students can feel at home, welcomed, get their studying and work done, or get their information needs met by frontline workers, our librarians.
Thank you. So there are microphones at each end, and the panel is very happy to take any follow-up questions or additional questions.